Welcome, everyone. We'd like to get started so that you can at least get home before the 5 inches of ice hits. Anyway, having said that, this is my 4th winter in Wisconsin, and all I can say is they lie. I wanted to welcome you to tonight's community lecture series. We have Amy Boelk with us tonight from the Department of Sociology and Social Work. I just did want to welcome everyone and thank everyone for your support this year in this series. We've had a great turnout with people this year. We've had some great talks. We have a number of really good talks next year as well. I'm going to give you a couple of titles here just to whet your appetite. From St. Nick to Santa Claus, that should be a good one, right around that time of the year. We're going to have something called Starbucks, iPads, and French Literature. That's going to be a good one for the people that can multitask. And molecular research and solar cell technology. So we're really going to cross the disciplines here. Having said that, we do want to apologize for Lynn Ludwig. Lynn will not be able to give the last lecture in the series, which was scheduled for, let me get this date right, May 9th. So if you routinely come to these, be reminded that Lynn cannot make that for personal reasons. Having said all of that, I'd like to introduce tonight's speaker. Tonight's speaker is Amy Boelk, as I mentioned. She is in our department of, she's an associate professor in the Department of Sociology and Social Work. She has a PhD from the University of Texas, Austin. She has her master's from Madison, and she has her Bachelor of Social Work from Eau Claire.
Yeah,
just kidding.
I know.
We have to do that as deans. We have a healthy competition that we have going with the deans around the system. Having said that, Amy has all of her degrees are in social work, and so she's a real expert in the area. I wanted to mention a couple of other things from her CV before I embarrass her, and some of those are some of the awards that she's recently gotten. She, in 2003, she was the Circle of Excellence Award winner, which was presented by Ministry Healthcare. In 2003 also, she was the Athletic Director's Award winner at Stevens Point. 2003, she was the Department of Excellence in Teaching at UW-Stevens Point. 2005, the University of Excellence in Teaching, which is the highest award that we give to teaching on campus. So we really do have a distinguished teacher with us. She has coordinated internships in our social work program, has been instrumental in our new social work major, which we are just getting off the ground, and we hope to really get started on that this fall. Prior to coming to UWSP, Amy gained valuable experience as a hospice social worker, a hospital discharge planner, and a case manager for older and disabled veterans. She has a fantastic background in hospice care, one of the best I've ever seen, in fact. Amy's research has strengthened understanding of family conflict at the end of life, hospice care in rural communities, and the recovery of individuals who have had a parent die by suicide during childhood. In fact, I think you and Marty Roy are getting close to finishing a book on that very topic.
Finally,
I don't mean to, nothing negative there, just finish the book.
Yeah, I know.
In her free time, Amy enjoys spending time with her 2 children, ages 7 and 3, yikes, and her husband Al, who works as a swimming coach at UWSP. Please join me in welcoming Dr. Amy Boelk.
Thank you so much for coming out tonight to listen to me talk about my research. My topic is family conflict at the end of life, which is maybe a topic that's not as fun as some of the other topics in this series, but one that we all can unfortunately relate to in some way, shape, or form. When I talk with people about the research that I'm doing, most people have a story to share on an individual level. And we've also discovered that this research has some pretty significant implications for professionals who are working in a variety of care settings, whether it's nursing homes, hospice, home health, hospitals, even churches and other organizations. Anyone who serves families and individuals at end of life may witness family conflict and may wonder what to do about it. I wanted to mention my colleague in this research is Betty Kramer from UW-Madison School of Social Work. And Betty and I have been working together and have actually been doing a lot of workshops and training sessions for professionals on this topic. We knew it was an important topic, but we didn't realize the demand for the professional community to have some more insight on how to approach the issues that they were seeing within families. So there's been a real need in that area. So tonight I'll talk with you just a little bit about the importance of this research and why we did it. I'll share with you some of what I think would be the most interesting aspects of our findings from our research, and I'll share with you just a little bit about what we've been talking with professionals about in terms of implications. And I know there'll be a question and answer period at the end, but I would also welcome any questions you have along the way as well. So first, to start out, I thought I better define what we mean by family conflict. So this was our working definition of family conflict: interpersonal tension or struggle among two or more persons within the family whose opinions, values, needs, or expectations are opposing or compatible. And we first developed that definition when we were doing a different study, which was based in the elder care program, which is a program down in Dane County in Madison that serves older adults. It's a long-term care program. So that was our working definition, and that's what we're talking about when we're talking about family conflict. I also wanted to just put this into context very briefly in terms of why we felt this was an important topic to research, besides the fact that there's been very little research done on this, even though it's something professionals and families are dealing with on a day-to-day basis. First of all, there's some trends within society that really create a context that's ripe for these experiences to occur. People are living longer, but they're living longer with often very progressive, complex health issues that require much more longer-term caregiving. Yet there are few family members available to participate in this caregiving because more people are working outside of the home, more family members are living at a distance, more family members have other responsibilities, so fewer caregivers, more caregiving needs. And that's all within a context within our healthcare system where there are some problems with communication and deficiencies. So there's just a context that's really ripe for family disagreements and tensions to occur. Along with that, families are increasingly involved in pain and symptom management, care coordination, and end-of-life decision-making. So they're increasingly stressed, and then they're increasingly expected to be involved in these types of things when a family member is diagnosed with a terminal illness, and they often don't feel prepared for the intense demands that that can bring with it. And then family members within a family often have different ideas about these things as well, so that complicates things further. And we also know, based on previous research, that family conflict can have profound consequences in terms of patient and caregiver outcomes. So we know that it's distressing for people. We know that it can lead to what we call complicated grief symptoms in caregivers and family members. And we know that it's the strongest predictor of ethics consults within hospital settings when there are families who can't get along and can't come to be on the same page with decision making. It can also impact where patients die. It can impact the quality of their care, and also caregiver well-being, depression, anxiety, those sorts of things. So it has a lot of implications for the experiences that people have. Just a couple of additional things. Hospice and palliative care guidelines, so professionals who work in these settings have a mandate to work with families. So it's an important topic because serving patients is also serving their family members. Yet research has demonstrated that professionals too feel really ill-prepared to respond to the conflict that they're seeing. They're not sure what to do. They're not sure how to assist families within the scope of the services that they provide. Okay. So again, these were some of the reasons that we wanted to investigate this topic further, and our research was really designed right from the start to then transfer into how do we help professionals with this. So again, a lot of education for nurses and social workers and other healthcare professionals so that they can best assist families. Okay, so now the study. And there have been a couple of studies that I've been involved with and Betty has been involved with that have looked at this, but I'm going to just share one of the main studies and just a few components of it. And I'm not going to make this overly researchy. I want to make it useful for you and interesting for you as well. So basically what we did was we were trying to develop a model of family conflict, a diagram or a matrix to help explain all the elements involved with it to people so that they could use it in their professional work. And what we did was we gained the perspectives of hospice professionals as well as caregivers of patients in a hospice program here in central Wisconsin. So we had three main sources of data. We did 161 surveys of caregivers who were actively involved in caregiving for a hospice patient. We interviewed 15 of those caregivers more in depth to really get a sense for their experiences. And then we did 10 focus groups with professionals, and 37 professionals from this hospice organization participated in these interviews. Okay, so we had a variety of data to draw from, and a benefit was that we interviewed and we worked with the caregivers while their loved one was still in hospice. So they were actively dealing with that at that moment in time. And we also got professional and caregiver perspectives, which was really helpful because a lot of the research done on this has been only from professional perspective and has not involved caregivers. So that was really beneficial as well. And this research has been published in the Journal of Pain and Symptom Management as well. Okay, so some of the key findings. First of all, our research verified that this is a common occurrence. Other studies have found it to be a common occurrence as well. In the survey, of the 161 caregivers surveyed, 57% reported that they were experiencing conflict within their family. Again, this is while they had a loved one enrolled in hospice. We also asked in the survey if they had what we called prior conflict. So conflict that they experienced before the onset of the terminal condition, and 48% that they said that they had some extent of prior conflict. So in a lot of these families, the conflict was there in their family history and wasn't necessarily related to the terminal condition. But some of those past issues, as we'll talk about in a moment, can kind of bubble up and come to the surface when a family is stressed and when they're faced with caregiving and decision making. So common occurrence, which was not surprising. A second piece, and I shared this on your handout that you have in front of you to provide a little bit more detail, is we came up with a comprehensive list of things that family members disagree about when they're involved in an end-of-life situation. Based on the interviews and the focus groups, we were able to come up with this list. And again, we wanted to use this to educate professionals and help them prepare for what they might experience when they're working with families. So you'll find the descriptions of these things in your handout, and you can read through that more. But again, families disagree about a wide variety of things, from caregiving issues to whether or not to use life-sustaining measures, to family involvement, whether or not the son is involved more than the daughter and who's doing what, to aspects of spirituality and differences in value systems. So all sorts of things that family members disagree about around a terminal illness or a death and dying kind of situation. Okay. And then the main piece that I wanted to talk with you tonight about is the model that we developed. And that is also on your handout on the other side in more detail. So a big part of what we put together is this visual model of family conflict that displays all the different themes that seem to relate to it. Again, so we could try and educate professionals. And this model illustrates that family conflict is really a multidimensional phenomenon. You know, it's something that has a number of aspects to it. What I'm going to do is I'm going to walk you through this model. And again, in front of you, you have the themes that fit into each one of these categories. And I'm going to share with you a quote from either a caregiver or a hospice professional to illustrate each theme. And I'm going to share just one quote, but please know that to make it into this model, the theme had to surface repeatedly in the data that we collected. So there had to be numerous reports of this by caregivers or professionals for the theme to make it into the model. Yeah, so I'll kind of walk you through it and share some examples to illustrate what we found. Questions so far before we start getting into this? Okay. So the first part on the model, so if you look at your handout, it might be helpful as kind of a guide, is the family context. So these are the things that family members bring to the table before they even enroll in a hospice program or before there's even a terminal illness that's diagnosed. Things in the family's background that have nothing to do necessarily with the terminal condition. There were a number of themes that we discovered can kind of be in that context that can set the stage for future conflict. Okay? So one is historical relationship patterns. Basically, how family members got along in the past, how they communicated, maybe past resentments, past conflicts, and also instances of abuse within the family that then came back later and impacted how families approached one another at end of life. So in this example, a daughter is sharing about her parents' divorce way back and the impact that that brought out now. And I'll read through these quotes. These two people hate each other, and that makes for a lot of tension. In the last 20 months, I haven't really had any interaction with my dad because he knows that I'm taking care of my mom. My siblings are trying to strike a balance between my parents. Mom is dying, and we want to spend time with her, but we know that dad feels that if you see her, then you're against me. That could be one reason that they're not as supportive as they could be. Okay, so a divorce in the family that happened way back when, but now that the mom is dying is creating implications for the siblings who are trying to provide care for the mom but still have a relationship with dad. Okay. Another one we found is family involvement in care, and this basically has to do with how much families are involved in care, and it can range from none to extensive, and it can vary within the family. And different levels of involvement in care can create resentments among family members, and it can also influence what people know about their loved one's diagnosis and health condition. Okay, so this daughter shared how her sister's lack of involvement was fueling conflict. She said, I have a middle sister who's not involved at all. We've tried to reel her in. We say, we need your help. We have to ask for it. She gets very upset with us when we ask her to do things. I've been sworn at, I've been hung up on. I've had excuses like, well, I have someone else at work who's going through cancer. And I said, your mother has cancer. Okay, so you can see how the resentment because of the lack of involvement has created conflict within this family. The third theme is family demands and resources. So this relates to other demands that maybe various family members have placed upon them, like other work and caregiving responsibilities, and that some family members may have more financial resources and